So let's talk about some of the symptoms of andropause, and that's a photo of John Turner from Etta Clark's book, Growing Old is Not for Sissies 2, which were portraits of senior athletes. I love this book. So it's got pictures of older people who look really good. And he's 67. So this is number 9 if you're following along on your handout and you're fill in the blank. What is andropause? Have you heard this term, andropause? No? Andropause is a term that refers to androgen decline in the aging male. So that's testosterone, along with symptoms. It happens gradually. So in women, we may notice the loss of our hormones more quickly. In men, this is something that can occur gradually. So a lot of times the symptoms get chalked up to, I'm just getting old. And here's what causes androgen decline in men. Low testosterone production. So the testicles just don't make enough. Increased sex hormone binding globulin. So sex hormone binding globulin is the sponge that soaks up testosterone, so less is available to the tissues as free testosterone. Or increased aromatase enzyme. Remember, that's the enzyme that testosterone is converted into estrogen from, and that tends to increase with aging. Well, how common is andropause or hypogonadism or low testosterone? The hypogonadism in male study found 38.7% of men over 45 have low testosterone, which they defined as less than 300 nanograms per deciliter. Less than 500, most men will have symptoms. The Baltimore longitudinal study of aging found 30% of men over 60 and 50% of men over 70 had low testosterone. And they defined that as 325 nanograms per deciliter. Now, interestingly, the Massachusetts male aging study found 24% of men 30 to 79 had low testosterone, but only 5.6% of symptoms. This is very curious to me, because sometimes men come in to see me, and I ask about their symptoms, and they say they don't have any. Nope, erection's just fine, libido good, memory great, energy superb, fine. And then their wives will say something. I've actually had them call me up. I don't know what he told you. So when it comes to the research that showed that only 5% had symptoms, even though 24% had low testosterone, I'm suspicious about what the men told the researchers. So the prevalence may be even higher if we look at the free testosterone or the amount that's available to the tissues. The age of onset, between 40 and 70, sometimes as early as the 30s. Unfortunately, I'm seeing more and more men coming to my office in their 30s with low testosterone. Testosterone decreases after about age 30 to 35. Remember, we are programmed for reproductive success, and when our reproductive capacity is exceeded, our reproductive hormones decline. Low testosterone is seen in 86% of men by the age of 80. 1990, there were 35 million men. Some predictions for 2025 depends on what you look at, 6.5 to 54 million men with low testosterone. This is something I call the spare tire syndrome, where testosterone is converted into estrogens. Remember, that's because of that enzyme called aromatase. So being overweight can cause testosterone deficiency. But it's really hard to break this cycle. So low testosterone, you have less muscle mass, you have increased insulin resistance, and more fat. But being overweight lowers testosterone. So this cycle is actually a positive feedback cycle. It's very hard to break that unless you actually get testosterone. Some symptoms of low testosterone or andropause: low libido, fewer morning erections, erectile dysfunction, so getting or maintaining erections, and decreased volume of ejaculate. Since testosterone is absolutely critical for the brain, you can see fatigue and low stamina in men with low testosterone, so the ability to keep going besides low energy overall. Loss of that competitive edge. Men often talk about this, that they just don't feel as competitive anymore, either in sports or in their business world. Low motivation, so the couch potato syndrome, just wanting to sit on the couch and pretty apathetic. Irritability. Sometimes people will ask me, is the testosterone going to make me aggressive? If you're aggressive already, yes, you will be aggressive. But physiological dosing, normal healthy dosing of testosterone doesn't make men aggressive. Low testosterone can actually cause reactionary behavior, otherwise known as irritability. Poor attention span, difficulty focusing, and depression and mood changes. In fact, depression and mood changes is really common with low testosterone. It can affect body composition and structures also. So there's a term called sarcopenia, which means less muscle, more fat. You start to turn your muscle into fat. Muscle weakness. Osteoporosis and anemia with severe testosterone deficiency, because testosterone stimulates the bone to make red blood cells, and insulin resistance, as we already talked about.